Yeah, others also you can prepare this card. Yes, Safuratu Al Hassan. Hello and welcome to
Thank
This is
you.
Grandmaster and I'm Peter Simon with you. Today we are conducting a speaking session for Safuratu Al Hassan from Ghana, Africa. Yes, Safuratu, once you're ready, you can start the session.
Okay, so okay, so please, how do I address you in the replay?
My name is Abraham Lincoln, and you can call me Mr. Lincoln. I am 51 years old, and I had a lesion removed from my hand following a diagnosis of squamous cell carcinoma.
Okay. So are we starting now? Because I just asked the name.
Yeah.
All right. Okay, so please we can start. Good morning. My name is Safuratu Hassan. I am one of the nurses in this clinic. How may I address you, please?
You can call me Mr. Lincoln.
Okay. So Mr. Lincoln, from the case notes, I could see that you had squamous cell carcinoma surgery last week, and you are here to remove the stitches, clean the wound, and then have a redress. Is that correct?
Yeah, of course, nurse. You're absolutely right. I'm little worried
Oh,
about the same.
okay. So, Mr. Lincoln, please um do you need us to clarify anything that's bothering your mind?
Yeah, I am little bit worried about this. I don't know why this happened, but I know. Yeah, I came here for the removal of stitches. The doctor has asked me to meet you.
Okay. So, um, Mr. Lincoln, I would like to ask few questions. I would like to know whether you know anything about your condition.
I'm not very clear, nurse. So, what is this squamous cell carcinoma? I think it's something like cancer. What do you think? Can you please
All
explain me?
right.
I want to know everything about this because this concerns my health. I don't want to take any risks. So please, please, please explain me everything related to this squamous cell carcinoma.
Okay. So, Mr. Lincoln, I really appreciate your keenness to know what's actually wrong with you. I could also see that you seem upset. Please relax. We are here to help you in any step of the way. So, squamous cell carcinoma is basically a type of skin cancer, which is usually caused by exposure of when you get too much exposure to sunlight or ultraviolet radiation. That is when you usually get squamous cell carcinoma. And some of the affected areas could be a place where there's too much sunburns, such as our face, especially around our lip, behind our ear, at the back of our hands, and some parts of our bodies. Please, but in your case, I would like to reassure you that the surgery was successful, and people who usually come for this surgery don't usually come back with relapse or any complications. So there's no really cause for alarm. Okay.
Yeah, that's so nice of you, nurse. Now I have a better understanding of what squamous cell carcinoma is. And I want to know if I am likely to need more surgery to remove other lesions in the future.
Okay, so Mr. Lincoln, it's natural to feel unsettled about your condition, especially after you have taken a step. But I would like to let you know that squamous cell carcinoma surgery um, don't usually come back again, or you don't get complications after you have undergone the surgery. And I would also like to stress that it is important now that we are done with the surgery. It is important that you try and then monitor your skin, especially you checking whether you have some changes, new changes in your body, or maybe notice some spots that you think it's abnormal. In that case, you regularly need to check up with the doctor to catch up with any early complications in order to curb that. Is that okay?
Yeah, that's fine, nurse.
Okay. So, do you have any other questions or concerns that needs to be addressed?
Yeah, actually, I think this was my mistake in my younger days. I always wear a high factor sunscreen, 30 or higher. I wear a hat when I'm out in the sun, but I think it's too late because the damage has already been done. I spent too much time in the sun in my teenage years. That might be the problem and the reason for today's suffering.
Okay, so Mr. Lincoln, I appreciate your concern, but I would like to emphasize that you don't blame yourself too much for what has happened. The deed has already been done, so we should rather concentrate on the guidelines that will prevent you from future or further complications. So I'll urge you to rather pay heed to whatever we teach you, the guidelines, the measures that you follow, so that you not get any complications. I'll also um, advise that from henceforth you try and cover up, especially when you are in the sun. You put on your sunscreens, and then you can also put on the hat, the sunglasses to protect you from further damage to the skin. Is that okay?
Yeah, that's absolutely fine, nurse. I'll make sure to look after my skin from now onwards. And yeah, is there anything else, nurse, that I need to know?
Yes. So regarding your wound, I'll urge you to always keep it clean, dry, and then covered to prevent any dust or infection. So you also um, make sure you report any pain or any discharges that is coming from the wound, so that we can try to treat that as quickly as possible. With that being said, the wound will be, we are trying to make sure that we remove the stitches. The stitches will be removed today, and then we will try to clean the wound, assess your progress, and then try and then you come back within 7 to 14 days for a review. Is that okay?
Yes, nurse, definitely. That's really fine, and I'll definitely do that.
All right. So may I seek your consent to book you for um the 14th day, or
Yeah,
yeah.
of course. One
All
more
right.
thing is the wound has been fine. There is no pain or discharge, but I still think it's
Oh,
too early to have the stitches out. What do you think, nurse? Should I keep for one more week or 10 days?
all right. So I appreciate your concern, Mr. Lincoln. Yes. So in a normal circumstance, the 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 stitches are supposed to be removed within 7 to 14 days. So in your case, I think this is the optimum time that we can remove the stitches so that to aid in the healing of the wound. I hope I have cleared your doubt.
Yeah, that's very fine. So that's okay. I am ready to have
Uh,
the stitches removed, nurse.
all right. Okay, so thank you. I'll go get my things and then come and have your stitches removed.
Yeah,
Thank you for your cooperation.
thank you very much, nurse.
Say, I wasn't seeing the words correctly.
Yes, wait. You can mute back. You can
All right.
mute back now. And okay, yes, right. Coming to the point, yeah, what's the name? The name is Safuratu Al Hassan. Safuratu, you're doing very well. There's no doubt regarding that one, but you are not, tuning some questions according to the pace. Because even before you asked, I had to tell you because you are little, you're trying to get the message that yes, I understood, but you have to move a little forward. Okay, so you have to go a little forward because in 5 minutes you have to finish all the speaking test. Remember that. 5 minutes. You don't have much more time. So 3 minutes you'll prepare and 5 minutes you'll do the speaking session. So in 5 minutes, there are three things which are very, very important. You have to understand this one. There are three things we have to you mute back. There are three things which you have to notice. What are those three things? Number one, the candidate talking time. Candidate talking time means your talking time. Your talking time should be 75 to 80%. 75 to 80% should be your talking time. At least 75. Right. That means the more information because you are tested and not I. You are tested. So maximum time you should speak. If I play football, how will you win? If the ball is with me, you are going to lose. So you have to take the ball and you have to run forward and you have to kick the goals. So that's important. So you have to take the ball into your possession. That's important. So the maximum time you have to speak, that is called candidate speaking time. Next one, the interlocutor speaking time means that means I am speaking, I am the patient, I am the interlocutor. So interlocutor speaking time. Now regarding interlocutor speaking time, it should be 20 to 25. It should be 20 means the best to 25%. Right. So maximum 25% and minimum 20%. Don't make me speak more because you have to speak more because the more you speak, the more you will be tested. It doesn't mean that 90% you speak and 10%, but I also should speak, but you should make me speak. That also you should limit. The control is in your hands. Remember that. You have the remote control. The next one is the third point is, yeah, the third point is zero talking time. That means when neither you nor I are talking. So this should be maximum 5 minutes. Sorry, 5%. 5%, not more than that, and it should not be delayed. So that delay was there actually from your side. So because of that, I had to speak. Two times I had to speak. You did not ask clearly that whether any discharge is coming. Said the wound is clean like that one. So you should ask that whether there is any discharge. You should ask me. Then I should tell that there is no discharge. And in the same way, sunscreen and other things I told. Yes, it's prolonging. Then after I told, then you asked you have to use sunscreen. So that you should have asked before itself. So make it in advance and finish it off. Be very strong. It is in your hands. See how I am talking. 80% I'll be talking, and at the end I will be asking you your suggestions. Like so, first I should ask, then you have to say, how is that? Okay, are you using any? You have to take care of your skin. You have to protect your body. Are you using any measures like such as a sunscreen, applying sunscreen, or are you covering your head with a hat or anything like that? So this is what you should have asked even before. Then I should have told it. Yeah, of course. You're right. I am wearing suns. So, like that one, I should. So, you should initiate that talk. Okay. You should initiate that talk. Remember that. So, work hard. Think about the points. Now, what you have to do is, I'll give you this. This is already recorded. I will get it printed. Then I will get it typed as a dialogue. Then that dialogue I'll give you, and that dialogue will be analyzed. What is your score? How many marks you will get? What is the percentage? How much time you spoke, and how much everything, all the details will be there. So I'll get from the script and I'll discuss with you what are the mistakes you are doing and how you are uh, progressing. Actually, the thing is, you have three areas you have to think. First one is fluency. Actually, you are doing a little better last week, but this week, I don't know, you got little lagged and you did not participate in speaking session 3 days or 4 days, I think so. Maybe because weekend is there, okay, 1 2 days, that's, but before that one also we did not do much. So try to do as far as possible. The next one is accuracy. Accuracy, I can tell you, it is something around 80% accuracy is there, but there's some sort of hesitation, so that you have to avoid. And lastly, pronunciation part. Pronunciation part, we are not native speakers, but try to do as much as possible. How you are going to improve is, how you are going to improve your pronunciation is, take BBC or CNN or uh, Fox News or Geography Channel or Wildlife Planet or something. So these where English or native speaker speaks, not some other national. There are many people who are speaking nowadays in BBC also, but they should be native speakers, and try to listen to them and try to repeat those sounds. Then you'll get that accent. That's what I can tell you. Okay, we cannot be 100%, but at least 50 to 75% we can get through there. That's fine. And regarding this, you have to learn some vocabulary. Now, what type of vocabulary you have to learn? So, I have a list of words which I'm going to give you, a list of vocabulary, and these are related to this particular every group. For example, this is squamous cell carcinoma, skin cancer. So there are some terms or vocabulary which is which are related to this particular thing. So what you can say is exposure, protection, application. Exposure to sunscreen is dangerous, and therefore protection is necessary. For this, application of sunscreen is recommended. See, all the three words I have used. So, like this, you have to know what sorts of words you are going to use, and you have to apply these words on a daily basis. So, right. Now, this is the way how you can practice. Uh, so now, yeah, now let us see who are they. So we have two new admissions today. That is Safuratu and Elizabeth. Right. Before we discuss with them,